With that, I want to call our meeting to order and welcome anyone who's on board and to the meeting of the Health Department or the Board of Health. My name is Kay Leach and I will be serving as chair for this meeting tonight. With me also, I'd like to introduce our board members. George Hageman.
George Hageman, retired from the biology department of Indiana University in microbiology.
Mark Norrell.
Hi, I'm Mark, and I was a former healthcare executive working in hospitals, and I've been teaching at the O'Neill School of Public and Environmental Affairs in healthcare management and policy for 10 years.
Stephen Pritchard.
Everybody, longtime board member, retired dentist, and that's it, Kay.
Carol Talukian.
I'm Carol Talukian. I'm a retired pediatrician.
And Bob Wren.
Bob Wren, a physician, retired, obstetrics and gynecology. I've been on the board for a few years.
With us, we also have our administrator for the Monroe County Board of Health, Penny Cottle. And behind her, I can see him, is our health commissioner for Monroe County, Dr. Tom Sharp. Hi, Dr. Sharp.
And he's muted.
He's lurking.
He's lurking in the background.
Yes.
Good to see you. And also we have our legal consultant and advisor, Margie Ross. Hi, Margie.
Hello.
Okay, that's who's on board with the Board of Health's meeting tonight. I would like to also, next on the agenda, open up for public comment. If there's anyone out there that would like to make a comment to the board, this is your opportunity to do so. Just raise your hand at the bottom of the screen and the technical people will recognize you. We are going to follow the 3-minute rule. You'll be able to speak for 3 minutes, and 30 seconds before your 3 minutes are up, you'll hear a little tone. That'll be a warning that you're almost up with your 3 minutes. So if there's anyone out there that would like to bring an issue to the Board of Health, please raise your hand at the bottom of the screen.
There are no hands raised.
With that being said, there are no hands raised. Then we will go to the approval of the minutes. These were minutes of October the 7th. Has everybody had an opportunity to read those? Any corrections to be noted? If not, do I hear a motion for approval?
I move that minutes are approved as written.
I'll second.
We have a motion and a second. Let's do a roll call. Hageman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I also vote yes to approve the minutes as written. Okay, next on our agenda is our public health reports, and we have first on the agenda IU. I think Kirk White was going to be here, and Kirk, are you there?
I see Graham McKean too.
Yes, Kirk was going to give the update. There he is.
Oh, and I do see Graham also, yes. Okay,
You get both of us today, so might not quite be stereo, but pretty close, huh? Well, hey, thanks everybody for having us. Let me try to pull up our slide deck here and see if I can give you a few. Let's see, a few statistics. Let's do a screen share. I think Penny will let me do that. Let's see here. Let me try this. Can you see that okay?
yes, we can.
Yes.
Okay, good. So I'll provide a little update today, not quite as in depth as I have in the past, but just the quick facts for you. Let me go to our vaccination rates first. We started out the semester at about 92% overall. And as you can see, the trend line there continued to increase up through this past week. So we started the semester in pretty good shape. It was, and then we've added about a percentage as people have continued to get vaccinated. So our overall rate now is at 93.2, and it's pretty consistent among faculty, staff, and students. When we started looking, of course, back in August, it was much less for students, but as they got to campus and continued along with progress, we're up to this level. So we feel pretty good about that. The other interesting statistic is our actual cases. If you go back again to the beginning of the semester, we were at 91 cases as we started, most of those being students. And we've seen a pretty gradual decrease, a couple of weeks there where we went up 10 or 15, but then back down again. This past week, we're down to 25 cases for the whole campus. And you can see that's divided among students and faculty and staff, just 5 on the faculty and staff. The symptomatic tests, and I thought I'd just, I'd show you the fact that we encourage people, if they feel like they have symptoms, that they should go and get a symptomatic test. And this would be either at our health center or at some other location. Some of these would be regular health center patients, but you can see that as we started out, people were concerned, and this really kind of tracks allergy season, they tell me, but people were pretty concerned about maybe they had COVID, maybe they just had the sniffles, they weren't really sure. Some of it ticks up when there's a requirement, if they're going to go traveling or something to that effect, they'll for voluntary tests, but here just for symptomatic, this is where they think they might have symptoms. This has seen a gradual decline as well. And overall, when they do get a test here, when they think they have symptoms, we've really found pretty consistently that it stayed at 5% or under as a positive rate. So we feel pretty good about this trend as well. And then finally, I just wanted to show you that we've been working diligently to get the influenza vaccine out. These are just, these are the numbers from our own mass clinics that we've done at Simon Scott Assembly Hall. The one on the 25th of September was around 1,400 given, up to 2,300 on the 12th of October. And then we've got up to a capacity of up to 3,000 that we could give. We've got staff ready and vaccine ready for that number on the 24th of October. And that can be a walk-in or you can make a reservation for that. And then even after these 3 clinics are done, our Student Health Center will continue to administer as requested. It can be done through the pharmacy operation there at the health center. And of course, we also encourage students to do that in the private sector at the various locations in town where they can get the vaccine, students, faculty, and staff, all 3. So that concludes the formal part of my update. I just thought I'd give you some of the update numbers. Penny thought that'd be a good thing for me to do, but I'm happy to answer any questions you might have as well.
Kurt, could you tell us whether that very admirable 93% calculation for the overall immunization of the campus includes people who are exempted in the denominator or not?
Well, if you're exempt, then that would put you in that the remainder of the 7%, the unvaccinated 7%.
Thank you.
Mm-hmm.
Good job.
Carol, didn't you have a question for Kurt about the makeup of that 7%?
Yeah, we asked that a couple of meetings ago about whether the 7% was mostly exempt people or people. I mean, who makes up that 7%?
You know, and I really don't have that number. I don't have that broken down. It's probably, we're probably keeping track of it someplace, but I don't have it.
Okay.
Kurt, you may not have this, and it's really just to satisfy my own curiosity of the number of positive cases that you're seeing. You don't have any clue how many of those people were vaccinated by any chance?
You know, I don't, but I know we've talked about that. It's consistent with what you're seeing in the general population.
Okay.
The majority of it is the unvaccinated. We do see some cases that do come positive from people that have been, but it's pretty, it reflects pretty closely what you're seeing with the general population.
Okay, thank you.
Sure.
Any other questions for Kurt? Kurt, we really,
Any hint that the football game population has changed the statistics at all? Or we bounced through that okay?
You know, Dr. N, we were concerned about that, and we've been looking closely because the good part is it's an outdoor event, but yet people are pretty close in the stadium. So we were watching after the first couple of home games whether we would see an uptick, and we really haven't. We thought we might also see an uptick after Hoosier Hysteria being an indoor event. But of course, that has the mask requirement, which we appreciate. And though it's sometimes hard to disseminate whether people are eating popcorn or drinking a Coke and have their mask down or not, our event staff has been pretty diligent about trying to keep that enforced. And we remind people as they come into the facility at Assembly Hall, but the mask requirement has really been helpful for us, I think, indoors. We've not seen an uptick in any of our numbers, either after the football games or after Hoosier Hysteria. But we also have to remember those bring in large populations from outside the community too. And as you all know, when that happens, we have to work pretty hard at reminding people that Monroe County has that mask mandate. And they've been fairly respectful about it, but some people just aren't used to it because other parts of the state, they're not thinking about it in the same cautious way that we are.
Kurt, we really appreciate it when you come on board and give us an update. So thank you so much.
I'm happy to do it. And again, let me just reiterate how we sincerely appreciate the great working relationship that we've had with you, all the members of the board. We like to think that we're one of the safest places you can be in the state, and you've helped us get that way.
Thank you. Graham McKean, are you there? Is there anything you'd like to add? Or
I am here. Don't really have anything prepared, but I would just echo our appreciation for our working relationship here. And honestly, we're seeing the lowest transmission that we've seen all semester. And I think maybe I've seen one mention of a football game in the last week from the last past one, but when you're averaging about 3.5 cases per day over this last week, it's very little spread out there.
You know, I do have a question for either one of you, since you sort of have touched on it, Kirk, is that towards the end of this meeting, we're going to be discussing the current mask mandate because it is scheduled to expire on October 31st. Do you have a general feeling if this mask mandate, and that's actually will have probably no bearing on what our decision is, because it really shouldn't. I'm just asking this, do you have a general feeling as to, in the university, the feeling if this has been helpful at this point? I mean, or has it been more of a burden?
Well, I think we would say at the campus that we've gotten to this good point because of our vaccination rate and the mask requirement. We hope that that you all keep in mind really the value of this, of the preventive action, especially with flu season coming up. And that's why we've really found that the students and the faculty in particular feel safer in the classroom environment with the mask requirement. And that's, you know, we've been able to come back to a full speed, full capacity campus because of the vaccination rate and I think the masking requirement.
Mm-hmm.
And that's been helpful.
Good.
People are used to it.
Yeah. Yeah. I mean, I know I'm, when I go to the auditorium, since we started that series again this year. So I know I feel better about everyone wearing a mask when I'm in a closed environment like that. So yeah, just curious. Thank you.
Thank you.
Thank you both. Okay, next on our agenda is the Public Health Emergency Preparedness Group. Is that Christina? There you are.
Hello.
Hi, Christina.
Thanks for allowing me to speak today. Again, my name is Christina Kemp. I'm the Public Health Coordinator with the Health Department. Each time I speak, I kind of look through and I notice that there's more and more non-COVID things being added to what I'm reporting on, which is exciting. Partly that is, you know, all the vaccinations that we are through the health department that is over at the public health clinic. So I'm not directly involved with that anymore as I was.
Which is supposed to look natural.
Cool.
A little
Probably
bit.
tingly.
And then also with Gravity taking over testing for our community testing site, that took a large part off of my plate as well. So you will see some different things on what I'm reporting. With working with the Indiana Department of Health, I do continue to be a point person for local requests that they have, such as they recently we brought a strike team in. That was the Ellettsville Christian Church vaccination and testing site. So I help with the logistics related to that. Also helping them find, they're going to be doing a district after action report and an improvement plan for COVID. Even though we're not done, they're going to be hosting that here in the coming months. And so just helping find locations that would be appropriate for that. Continue just to do the monthly Zotec scheduling for the public health clinic, kind of that in-between person between Zotec and them through the Indiana Department of Health. I've just been working on the preparedness grant and also working on deliverables for this year. As far as some community things, I had some pet first aid kits that had been in my office, and as things, you know, we had the flood here, and as things are getting moved around, those were something that when I very first took the position, I wanted to get out. And so we had 60 of these pet first aid kits that were donated to the Bloomington Animal Shelter for anyone that was adopting a new pet. Information just on general preparedness went out with that, just to try to encourage people to set up their grab and go kits, make sure their pets were included and so forth. I am still working with MOCOAD, or Monroe County Community Organizations Active in Disaster. There's a small group of us. We're kind of getting together to revamp the group, expand membership, see how we can improve response. Also, after the Morton testing site closed, I inherited, I guess we'd say, a large amount of some testing supplies and PPE. So a big part of what I've been doing recently is just trying to get those things out to appropriate agencies, really focusing on long-term care, just not huge amounts of PPE, but just getting it to where it was needed with long-term care, assisted living, home health. Also to health departments in other counties that were needing some testing supplies. And also looking at space for when the Moderna boosters and J&J boosters become eligible for people. We know that it may be necessary to increase the space where the vaccinations are currently being given in the public health clinic. So I'm helping look for sites for that. And internally, we are working on our COOP plan, our continuity of operations plan, just to renew and revamp that, which the whole Monroe County government has been doing. We're planning for a call down communications drill soon, just kind of waiting to see if District 8 is going to do that, and we'll kind of tag in or link in with them if so. Otherwise, we'll do our own independent call down drill. And then the last thing I want to mention, I went to local health department meeting with IDOH yesterday. Penny wasn't able to make it, so I was really grateful to be able to go. And one of the things that they reminded us of was the Be Well Indiana. It's a program through the Indiana Division of Mental Health and Addiction. And it's really the program sounds great. And there were a couple of people there that gave a testimonial about it as well. And you're able to speak to a trained counselor 24/7, totally free, totally confidential, related to stress, anxiety, loneliness, or any other mental health issue that someone's having that's linked to COVID. They also have a crisis text line, and they said they would probably take out the word crisis now, but someone doesn't have to be in a crisis mode, but just someone that's having some struggles. And I think probably most of us during COVID have had that, and probably could have benefited from using this. They also have a website, it's bewellindiana.org, and that's for any Hoosier. It's not just for healthcare providers or health department people, it's really for anybody. And on the website or through the counselor, you can get resources, there's videos, there's those live people to talk to. They do also have non-English speaking resources available. So I just wanted to mention that while I have this opportunity. That's all I have.
Does anybody have questions for Christina? Thank you for the update.
Thank you.
Next on our agenda is the administration, and Penny, that's you.
Yes, so I know that you received a few highlights from various divisions of the department, but a couple extra things that I just wanted to note. We did meet this past week with our schools, K through 12 in the community, to really just check in and see how they were doing, what was going well, what challenges they were having. There is an opportunity for some funding to come through the health department for schools. And so we want to make sure that we're taking that money, that we, number one, get most of those funds directly to the schools, and that we meet the needs that they have. So it was nice to be able to hear what that meant, and we will be moving forward to figure out what that looks like and how we will do that. But we've got a good relationship with the schools, and I appreciate that. I think every one of them attended one of the two meetings that we had. We ended up, it was we were covering that fall break, so it's kind of hard to get everybody, but I think we managed to get pretty much everybody who was able to attend one of those two meetings. So we're glad to be able to move forward with that. We have completed interviews for the current vacant positions that we have. We'll be moving forward with those job offers and such, and then we'll move to the next phase that we will have in terms of filling vacancies. Something that I think I reported on this maybe back in August or the 1st of September, our vital records staff met with the baby unit at IU Health to really talk about some of the challenges. Some of the new parents seemed very confused about how to get their birth certificate and those kinds of things. So we met with them to do just a little bit of problem solving and have a discussion between us about what their process was, what our process is, and then how we could improve. And one of the things that we did was develop a brochure that they could give at the hospital to all the new parents. And that has been printed. They've been using that. And the vital record staff has reported that they really are seeing fewer calls. So they said that
Okay, I have removed everybody's ability to unmute and turn on their videos. So we are going to slowly start enabling people's ability to do so.
So Michelle, should somebody just continue with their presentation at this point?
Yes, that would be great. I'm probably going to keep video off just for the time being.
That sounds good.
And we may or may not turn it on later. We'll
Okay.
find out.
Sounds good. Penny, I think, was in the middle of her presentation. So Penny, if you can unmute, do you want to continue?
I am not allowing the ability for people to unmute. People, I will give the board the opportunity to unmute. If they would like to stay unmuted, they will need to not hit that mute button.
Gotcha. Do you want, is it okay for you to unmute, Penny?
Penny, feel free to go ahead and unmute yourself now. You specifically have the ability to do so, and you may go ahead when you are ready. Hey, Penny, can you give me a mic check real quick? Okay, I believe we have lost Penny. If you can hear me, if you could go ahead and disconnect and reconnect, I'll get you all set up.
Michelle, are you asking all of us to unmute on the board?
Yeah, because most people are not going to have the ability to hit unmute by themselves, so I have to prompt. Oh, okay. I guess that's what happened. One moment.
Okay, Michelle, can you hear me now?
I can hear you now.
Yay, thank you. Thanks for all your work on this. So
Yeah, no problem.
our vital records staff has reported that they were receiving multiple calls a day from parents thinking that they were supposed to get their birth certificate automatically in the mail and those kinds of things. And they've only had 2 calls in the past 2 weeks. So that initiative actually has been very, very helpful. So I wanted to share that with you. The Governor's Public Health Commission held their first meeting today, and that is to look at the public health system and public health funding. In Indiana, Dr. Judy Monroe, our previous health commissioner, is leading that commission. And they heard today a report on the public health workforce in Indiana, local health departments, how they're staffed, kind of what's known, what's missing. They discussed a little bit about funding, but finance will be their next meeting. And those are live streamed. And I think that I sent you information about that, but I can resend that when I get information about the next meeting. But one of the things that I did find interesting today when they were talking about the numbers of health departments. So there's 94 health departments now, but 69% of them have fewer than 50,000 people in their county. So their population is less than 50,000. Of the counties with 100 to 200,000 people, we are in that 12% group. So I thought that that was interesting to kind of see that breakdown. I hadn't seen it that way before. And other than that, I think that's my things that I really wanted to share with you at this time. Thanks for your patience.
Do board members have questions for Penny?
I do, please.
Mm-hmm.
What kind of money are we talking about for schools from Indiana Department of Health? Is that do you know?
Yeah, it will depend on population and probably all told, because it will require us to hire somebody to coordinate it. But we're probably looking at $330,000 to go to the schools. And we have to figure out, obviously, how to equitably split those funds and provide some need. And then some of the things that we'll be doing with a coordinator will be to help them make sure that they've got the ability to contact trace, those kinds of things. So we're just working through that. Right now, we are at a stage of a letter of intent that it really came to us very, very quickly. I will tell you that as a group of local health department managers, we've been talking with the state about how the money kind of came to us. I haven't talked to a health department yet that didn't want the money to go directly to the schools and not put us in the middle of it. But that's kind of not the situation that we're in. There's some stipulations in the letter of intent that create a few barriers. And so we're trying to work with them to streamline and make sure that we're not caught in a situation where we can't use the money with the schools the way they need to be used. There are some counties who have said they're not going to take the money because of they feel that it is going to pit them against schools. There's an assessment that's got to be done. The schools have to, it's really them doing all the things they're already supposed to be doing. The reporting in the portal, doing their contact tracing and those kinds of things. But it will mean that we have to watch that maybe more closely. And so we'll have to have somebody really connected with them, a liaison to do that. So we're trying to work through and see what that will look like. It is ARPA money that the state is getting, and a portion of what the state's getting is to support schools.
Sorry, what money is it?
The recovery fund, acronyms are bad. The American Recovery Funds.
Right. So you divide up 330,000-ish among the schools in Monroe County. I hope that ends up being significant enough for them to want to sort of do what is necessary to get what is, I think, it sounds like a fairly small, a modest amount of money.
Yeah. Right. Yeah. Well, and you know, like most places, when we talk to them, when you talk about staff, most all the schools have staff. They have vacancies right now they can't fill. And so that's one of the concerns. If the state is saying that you have to hire X number of people and you simply can't find them, then we're stuck doing the work without the extra staff. And so that's some of the kinds of concerns that county health departments have. And so we do want to look at how we can be equitable and how we can put the money to use to be helpful. So I think one thing will be to be able to offer help with contact tracing and maybe increase that capacity at each school, but we'll see what they need.
This is a new category, a funded but unpersoned mandate.
Yeah.
And I wonder if schools can work together, like can they throw in together on things? I'm sure they can.
We did have that. We did have some of that discussion. And like I said, right now, we're just kind of in that. This is, we're willing to look at taking these funds, not fully commit, but say yes. The letter of intent is non-binding, and then figure out what that looks like. We do want to put some of those funds to increase testing because that's what the schools right now are needing. So that did come up. It will mean for us an individual contract with each and every school. So it is not without a lot of labor.
Penny, I don't know if you want to talk about it now or later with the regulation, but I had a question about Seven Oaks. Are they in compliance?
We have been out, and I would say that they are not fully compliant. We are planning to go out again. We have, they do have some exemptions. I did hear from Dr. Ship today, he was unable to be here tonight, that they do have more people who are masked, that they have had people who have filed exemptions. So we will be looking at what those exemptions are and following up on that.
Will you report back to us on that, please?
Yes, I will.
Thank you. Board members have any further questions of Penny? Okay, next on, I'm sorry.
Before we jump, I want to add one more thing because you just popped back into my head. One of the things that we've started doing is we put all of our schools into, we numbered them. We are doing sort of a random drawing each week and selecting a few schools to put on Security Pros list for site visits. So they completed, I think we're usually doing somewhere around 3, mix it up a little bit. They did 3 last week. Aaron can report on those. I think they were all in good compliance. And we thought that that was a good way to check in on all the schools, be consistent and fair and check on all of them. And we have just a random poll every week.
Just a FYI, I did read that today the CDC said that schools that they recommended keeping the mask mandate, and they said that schools that did not have the mask mandate were 3 times more likely to have COVID cases, if I read it correctly.
Yeah, there are several studies. I think I might have, I don't know if it was the last meeting or just an email to you that I got and I forwarded, but there are several studies that have been done now on schools with masks and no masks. Yeah.
Okay, thanks, Penny. Next on our agenda is from Aaron Waltz. Aaron, can you show yourself? If you would please change your video on the screen. We can see you. Aaron, are you there?
He's muted.
Sorry, we were having some troubles real quick.
I think yeah, probably it's an IT. Yeah, I was gonna say it's an IT thing.
All right. How's everybody today?
We're good, but we can't see you.
I don't know if do I have permission for video? Yeah, I don't have permission for video.
Yes, video is not enabled, but we will be able to hear him.
Perfect.
Okay.
So-
Okay, Aaron, we can hear you.
Yeah, so I'll pick up where Penny kind of left off. We did visit schools. We visited 3. We visited Marlin Elementary, Edgewood Intermediate School, and Grandview School. Compliance was really good with the schools. The teachers and staff are working really hard. Obviously, it's a tough job to keep masks on the little ones as they go about their day, but they are doing a great job at those 3 schools that we went to. Of getting kids to do what they need to do and maintain the safe classrooms for them. We also went to the revisit on the Seven Oaks School. Penny touched on it a little bit. There's some things to work on, but it sounds like Dr. Ship and his group are working with Penny to get that, and we'll continue to work with Penny if there needs to be revisits or anything like that. Some of the complaint inspections, some of the things we're seeing is a lot of times when we go out on the complaint inspections that we get from the health department, once we work with them, we see a lot of corrective actions. I would say that most of them, not all of them, but most of them do take the corrective actions that we recommend, that we encourage them to take, whether it be signage, whether it be mask. I know we've handed out masks to certain businesses that say they can't afford it. So the businesses themselves are taking the proper actions to correct those things. Customers are kind of hit and miss. Obviously, like Mr. White said, with IU, you get some that come from different areas and different places throughout the state, and they don't understand that we do have a mask mandate. So a lot of the businesses have done a really good job at reminding folks to put the mask on, wear the mask when inside, when moving about the restaurant, if not eating or drinking. So we're seeing a lot of good things. We still have a lot of, I shouldn't say a lot, we still have some businesses that aren't moving as forward as quickly as we would like them to. But again, we're working with Penny and Margie on that, setting up different things to help correct those actions. So other than that, we've seen, a lot of good things throughout the community as far as people protecting themselves and protecting others with wearing the mask, which has been a good thing for us. And, again, I'm sure depending on what you guys do on the 31st, we'll get the fall off of, oh, I thought it lapsed on the 31st if we move into November or whatever. But again, we remind them and everything seems to go back, but they like to use that as a crutch to kind of get away from it for a while.
Do board members have questions from Aaron?
Yeah.
Aaron, thank you so much.
Again, I can't tell you guys how good of a job the schools are doing. The 3 that we went to this last week, they've done a really good job, and kudos to the staff of those schools for making the environment safe for everybody.
That's good to hear. Thank you.
It's a really good observation, Aaron. I think it just reflects the fact that kids are not resistant to wearing masks, and they really adjust very quickly to it and without a whole lot of difficulty. That the mask resistance doesn't come from the kids.
Exactly.
The kids are good.
Yep.
Okay, we move on to the agenda. We're down now to old and continuing business under regulation review.
Michelle, is it possible for me to share my screen or not?
Yes, you have the ability to share screen. Go ahead.
Okay. All right. Okay. Can you see that?
Yes.
All right, very good. Okay, so I really want to pick up a little bit where we left off last time and reiterate a few things. So with testing options, there are lots of places to go and get testing. The Gravity site is open Tuesday through Saturday, 8 to 4. It's at 500 North Profile Parkway. It is still a drive-through clinic. So if we have storms, they may close, whether it's an hour or the rest of the day, weather dependent. They are looking to move inside, so that hopefully will happen in the next couple of weeks. They do PCR testing at this point. Results are supposed to be back by 5 p.m. the next day. And this is on Cook property. So if you're looking for that site on the map, on that coronavirus.in.gov, you go there and you're looking for the property, it says Cook, it does not say Gravity until you kind of get deeper into it. So just to let you know that. I would also not recommend that you use zip code because that may not pull it up for you. So yeah, you might be able to put in a particular zip code that will, but I have not been able to have any luck using zip code. Indianapolis Motor Speedway is still open until through the 30th of this month. Very similar information, Tuesday through Saturday. It is open noon to 8, and it does suggest that you look for it using a zip code that is 46222. But there are lots of options for testing. And the mobile sites, we continue, the state does mobile sites every week. They have them different places. So we will probably have some mobile sites again back in the county.
I just want to say, Penny, that I did go to the Gravity site yesterday. It was, in fact, I didn't get my result back, but
it may be waiting for you.
it was quick and easy. I mean, there was like 2 cars in front of us. They bring you stuff, you fill it out, and you're out of there. The only thing is it's difficult to, it's not clear where to leave. You leave the same place you go in. It kind of takes you out the parking lot, and then you're kind of out there in the middle of the parking lot. But it's pretty easy to find. They have a big sign outside of it.
Yeah, I think as they continue to be there, they continue to make improvements as well. Does not require an appointment. So that I think is important. So when we talked about at the last meeting in September 22nd, I wanted to do a little bit of comparison. You can see that we looked at the county metric map, and at that time, where we were, there was lots of red and orange in the county when we looked at it there. And then when we looked at the individual metrics, right? The cases per 100,000 and the percent positivity, you can see that things even looked worse, even though we were kind of an island of better, not good, but we were an island of better. And based on those things, we talked about some predictions. So at our September meeting on the 22nd, we talked about sort of best case scenarios, and that by October 6th would be the earliest that we could move to yellow. Well, we did make it to yellow. We're in a yellow advisory now, but we did that on, I believe it was October 13th. Didn't make it quite as quickly as we had hoped. And then best case scenario then would be October 20th to hit blue. And we have not done that yet. Our cases currently are at 111 per 100,000. So just wanted to kind of go back over where we were at that point. The other thing that you were seeing that we looked at the September 22nd meeting was that the positive cases was kind of doing that sawtooth. It was going up and down, but it was still kind of on that upward trend. And the good news is, if you look at that now, it is on a downward trend. And we're seeing that statewide as well as here. So that is some good news that we want to share. The metric map, the advisory map this week, you can see that we are still in yellow. The cases per 100,000, as I mentioned, are 111. Our positivity rate this week was 4.46, which was up slightly from last week, but still less than 5%. So we are seeing some improvements. This is this week's comparison from last week to this week. And so you can see that even as a state, we are seeing lots less red. There's only 4 counties that are red this time and lots more blue or yellow. So we're seeing positive trends. When you look at the hospital census, when we looked in September, again, the census was going up. When we look at it this week, it's coming down. And this is a statewide census. So again, good news. In talking with our local hospital, they're starting to see a trend downward as well. Over the last couple of weeks, locally, we've been a little bit stagnant at the hospital. So they were starting to see a slight decrease, but not really a downward trend. But I think they're starting to see that improvement. And then talking about boosters being available, I just wanted to show you the map, the dashboard. Thank you. On the state has now added the booster vaccines that we're giving. And you can see we're very busy on Miller Drive, for example, but what's driving that is the boosters. So our vaccination rate is over 60%. Now it's just under 61%, but it is a very slow rising number. But when you look at the number of vaccines that we're giving a lot of booster doses. So currently our fully vaccinated eligible population, the rate for that is 60.7%. So we're making headway, we're improving, but it is a slow process. Vaccinations are available. There are lots of different places, ourshot.in.gov. Always want people to go there to look for where they can be vaccinated. The public health clinic on Miller Drive is open 5 days a week. And as Christina talked to you, we are looking at how we can provide some additional space and expand that capacity once Moderna and Johnson & Johnson boosters are available, and once we may have children's vaccines ages 5 to 11. School clinics are wrapping up for COVID. We didn't have a lot of takers on the COVID vaccine. It was a few, but the acceptance of the flu vaccine has been extremely high. So we're very pleased about that. The nurses plan to go back to the schools and offer COVID vaccine to the 5 to 11-year-olds in the schools. We anticipate many parents will want to take their children to their provider. So the pediatrician's office in town is gearing up to offer that vaccine for their patients as well. And then we will assess if we need to do maybe some special clinics, maybe some Saturday clinics, things like that to make it available for parents who can't either do it with their child at school or do it through their provider's office. So we do have plans for how we will get those boosters available and how we will get children 5 to 11 vaccinated. And a couple other things, there's Halloween safety guide out. And the Board of Animal Health has also released tips on how to keep your pets safe this Halloween. So we want people to remember those things. And of course, lots of talk about vaccine updates. As we look at that, we anticipate next week having a decision about the boosters for Moderna and Johnson & Johnson. And it's really just the final recommendations from the CDC that we're expecting and waiting on. It does look like we'll be able to mix doses if somebody comes in and they had Moderna and for some reason Moderna is not available, they can get a Pfizer vaccine. So that's the way it's looking. And we will know more about that next week. We anticipate at the end of the week. And then the ACIP committee meets November 2nd and 3rd, and that's when we anticipate that they will be deciding on vaccines for children 5 to 11. So it should be early November when we find out about that and have those become available. So with all that, just want to go over kind of tonight's decision. The order is set to expire on October 31st. We will not meet the goal that we had set, so that's not an option. So you can extend the order until we reach those cases per 100,000 that you set. And if you do that, my opinion would be that you simply say that, for instance, midnight on the Wednesday that we hit that level is when it would expire, as opposed to extending it, for another month. You're meeting monthly anyway, so you can review it every month. You put that date in there kind of because people wanted it, but we are so close to meeting that goal. I would probably just say when we hit it, at what point of the day, or how many hours after we hit that goal do you let it expire. But then the question is also, if you extend it, do you want to make any changes to it? You did have another request from a church to allow them to unmask in their sanctuary if people are distanced. And so you can address that or any other changes that you might feel are necessary. Remember that you can't treat churches or places of worship differently. So you do need to think about what that change would mean for other venues that would have people in them as well. And then you could let it expire and see what happens. So those are your options, and I will let you discuss that, and I will quit sharing my screen.
Okay, board members, do I hear discussion regarding the regulation?
Yes, I'd like to make a comment. Kirk White gave a comment that 93% of the IU students were vaccinated. And Penny revealed that the Monroe County was about 60.7% vaccinated. Where does that put the local people? Their vaccination rate is lower, much lower than average. If the IU tips the scale uphill, shouldn't we continue being careful about opening the door if our community is not vaccinated?
Anybody else?
I would agree with that analysis. I think that we're still in a situation where a lot of the states in the northern tier are now seeing a bit of a rebound. I mean, things look relatively good at the moment, but we have both a new variant on the horizon and also this sort of odd situation with IU being very highly vaccinated and low caseload. I would say extend the regulations until we reach the appropriate per 100,000 limit. And I agree with Penny's suggestion that it be made on the Wednesday to be consistent.
I agree with what both Bob and George and Penny all said, because I think the reason that we're doing so much better than the rest of the state is because we have a mask mandate. And I don't see any reason at this point to back off from that. And I think I really like the suggestion, just when we hit our goals on the Wednesday at midnight, then we can rescind it, but with trepidation, I might add, because we don't know what will happen when we get rid of it. We may bounce right back up and we may be back to where we were. But I think that, I think we should keep it. And I like that. I really love the way you about having it expire on the Wednesday if we hit our goals and not changing our goals.
Mark, Steve?
Is an emotion appropriate?
George, would you like to make that a motion?
I would indeed like to make that a motion.
Okay, and I'll second that.
We have a motion and a second. We'll do a roll call. Hegeman?
Yes.
Norrell?
Yes, as long as we actually put that quantitative measure in there, that's 50 cases per 100,000.
50
yes.
per 100,000. That's a friendly amendment. Thank you.
Richard,
Yes.
Talukian,
Yes.
Ren,
Yes.
and I agree, yes. What about, we need to discuss this letter that came from the church. We did meet with the pastor last meeting, and we discussed this at great length. Basically, the letter says what he told us at that time, that they're asking for an exemption for the mask if they can sit 6 feet apart as family units. What's your pleasure on that one?
This is to be in the sanctuary, and I assume there will be singing. And we don't know what the quality of the air handling is in specific sites to which this would apply.
Yeah, and Margie can chime in if I say this wrong, but I think that you would be looking at making an exemption across the board. This isn't about an exemption for one place,
Right.
or we would be looking at hundreds of requests, so.
Yeah, that's correct. And you know, it would be a universal exception. So think about what that looks like, you know, in schools everywhere, and whether, you know, Penny, you might want to weigh in on an enforcement. I think it'd make it enforcing a nightmare, but I'll let you weigh in on that.
And it's also contrary to the CDC recommendations.
It is. And I know that there was concerns and comparisons about, you know, restaurants and what have you, but there is a reason that people who are dining are allowed to unmask. Even in the schools, obviously during lunchtime, people unmask while they're eating, but then they are considered close contacts and have to quarantine and do all that if they're exposed. So yes, I mean, this would go back to really the regulation that we had last year, where we allowed places to be 6 feet apart. So you're looking at a movie theater or the auditorium or any of those places. I suppose the question would be masked or 6 feet apart, but it would be a broad exemption, so. And it may only be, I guess the other thing that I would say, for better or worse, it may only be a couple of weeks. It could be a month. You know, who knows? I have no crystal ball on what these cases will do. Certainly could be another month before we get out of this. It could be a few weeks.
My general sense is that, you know, because of the broad applicability, you know, not just for one institution, but the broad applicability would just be a mortal wound to the intent and the functioning of a mask mandate. It just, you know, it would just, the whole thing would sort of cave in, and we would no longer really even be able to say it was a mask mandate.
I agree, Mark. Yeah.
Would you like a motion, Penny, regarding this letter?
I don't think we need a motion. Do we? I mean, if it's not our intent to change anything, then we don't need to make a motion.
Perhaps we can just deputize Penny to convey the opinion of the board to those who inquire.
We will make sure that it's in the minutes that you discussed it, and there was no motion to move it forward.
I would like to say I do have empathy for the situation, and I think, you know, I understand they're working very hard to try to make it work, but it really comes down to the fact that it's unenforceable, and it would just create a huge nightmare for everybody. So But I do have empathy for situations like this particular one where they make so much effort to try to do it, but it just, we can't change the regulations for one group.
Yeah, absolutely. That pastor could not have been nicer when he came to talk about that exemption. I mean, if there was again, it's so difficult to make these decisions knowing that people are inconvenienced by this, but we just have to consider all the angles for health here. So it's just, yeah, exactly.
Can you imagine the function of one of my classrooms where I have 60 students in a classroom that, we have to live with it. The instructor, me, I've got to wear a mask when I'm teaching, and all the students wear masks, and we do what we got to do. And I just hate it. My students cannot see my facial expressions. They don't know when I'm kidding around and I'm smiling, and I can't recognize faces as well as I did. I'm not learning the names because of this, and everybody just hates it, right? And I can't wait for this to go away.
Penny, now, if we reach our goal and it expires at midnight, our regulation, then say the next time, a week from then, or 2 weeks from then, we go back the other way. We can call an emergency meeting and go back to where we were again.
Yes, you can. You have to have 48-hour notice so before you can meet. And of course, this now goes to the commissioners. So we will prepare this and get it on their agenda for next Wednesday. And if you called an emergency meeting, we can notify the commissioners so that we can time things to have them hear it as quickly as possible as well.
Okay, well, anything else about the regulation?
Who would trigger the need for an emergency meeting? Penny, would you inform us? And then perhaps Kay would.
Your chairperson can call an emergency meeting, or a quorum of you, or the health officer. I think that I've gotten all but the chairperson. So yes, we will keep you informed. And again, you've been meeting monthly. I will assume that you're going to schedule a meeting for November probably. And so we will discuss it then. But if something it happens before then, I suppose what may make a difference, if we simply went back, if we just went over the 50, but we were still in blue, would that trigger an emergency for you? Or would that wait until the next meeting, for instance, so that you could see that there was a trend that it was going up? I would assume you would want to see that there is a trend. It wasn't just a blip, but that might be the thing. But I can send you a weekly notice, and of course you can look on the dashboard, but I can make sure that you get that link and see where we are each week. And then if you want to communicate with the chairperson that you want to discuss it, we can make that happen.
Yes, thank you.
Okay, we're down to new business. Does anybody have any new business? Board member comments?
Where do we stand on the issue surrounding the search for documents regarding the variance that was before us?
So far, the individuals, I think that the parties that were together part of them have stepped away. Part of them may still be looking on their end, and they've been advised to let us know if they want to come back before the board. Since, as we stated, there's really not an authority for the board to give it, but if they want to come back and present evidence that, and have that discussion, they've been told that all they have to do is let me know that they want to be on the agenda.
Good, thanks.
Dr. Sharp, are you there?
Yes, I am.
Is there anything you'd like to say before we leave tonight?
Well, I think you've done the right thing for the moment. I hate the masks also. Can you hear me?
We can.
A little
I
bit.
hate the masks also, but it's the result of a lot of people's behavior that a lot of other people have to suffer to be inconvenienced. So I just, I don't know. I'm tired of people that don't want to comply. I don't know. They are a vexation to the spirit, as it says in Desiderata. So it's just it is what it is. You're doing the right thing.
Okay, Margie, do you have anything you want to add?
No, I don't. Well, I guess on one thing on the variance, I just want to emphasize the point that Penny said that our current code does not allow the Board of Health to make an exception or allow a variance to the 1 acre requirement. So I would encourage, anybody who wants to come to the board to know that up front, because it's just not something you can do. So kind of, a futile effort to come and talk to you about a variance when you don't have the authority to grant it. Now, obviously, the county commissioners could write into the code an exception, but a lot of counties have that 1 acre requirement. And I don't see a real good reason to have an exception. So unless somebody here does, and that's something you want to entertain at some point, but kind of on a slippery slope when you start doing that, because we have a lot of lots that are so sloped that it's real difficult to put on a small parcel. So that's my 2 cents.
Thanks, Margie. Okay, let's look at a date to come back and have our next meeting. We've been meeting every 2 to 3 weeks. We were meeting every 2 weeks, and then we kind of gotten 3 weeks, I think. Let's see, today being the 21st, October 28th would be 1 week away. And then November the 4th, if it was a Thursday, the 11th, that'd be 3 weeks away, I think. So we're around the middle of November. I'm just going to throw out a date and see what happens here. How about if we meet on November 16th, which is a Tuesday?
Yeah, I like meeting on Thursdays if it works, just because we have the information from the state on the COVID numbers, and it says a good time for us to be making decisions if we can meet on a Thursday. It seemed to work out well for this week.
That's a really good point, Carol. How about then the 18th, November 18th, which would be a Thursday?
Okay with me.
Maybe 4 weeks from now, that'd be fine with me.
Steve, you said it'd be okay?
Yeah, that's fine
All
with me.
right.
And at
George?
5 o'clock,
Again, 5 p.m. would be good for me. Early would be a little more difficult.
Okay, and Mark, how about you? And Bob?
Yes, I can't do Tuesdays, but Thursdays would work.
All right, sounds like we've gone to Tuesday, November the 18th at 5 o'clock. Thank you so much, everybody. I'm sorry for the interruptions we had, but thank you so much for attending, and thank you. See you next time.
Thanks.